Mogbonju Nigeria Limited Virtual Medical Exhibition and Speaker Series 2020. Today's exhibition promises to be exciting. We have interesting topic for discussions today. We have new products exhibitions to showcase today, and as well as we have a whopping 10% discount offer on all of our products. We'll also be taking you through some videos from our previous exhibition, as well as getting some information from our numerous customers, as well as our manufacturer across the globe. The program now is about to start. If you are yet to fill the attendance, kindly do so by writing your name in the chat box, your detailed information, that is your name, your phone number, and your email address. Thank you for your cooperation. We are starting the program any moment from now. So because of the current situation around the world, Nigeria, not an exception, it is very difficult for us to meet or to gather a large number of people physically. So Mogbonju Nigeria Limited have taken the initiative to host a virtual exhibition. This is a virtual medical exhibition organized by Mogbonju Nigeria Limited. I would like to give or speak about the company's profile. Mogbonju Nigeria Limited, the distributor of medical equipment, not just medical equipment, but high quality medical equipment. So Mogbonju Nigeria Limited is an indigenous limited liability company that is based in Nigeria. We specialize in the manufacture and the supply, distribution, installation, and also maintenance of high quality medical equipment. We also supply medical furniture, medical consumables, medical instruments, surgical instruments, as well as medical reusables. Mogbonju Nigeria Limited started as a medium-sized outfit under the trade name Mogbonju Nigeria Enterprise in 1983. Then it was the sole distributor for the product of Seaworld Medical, a company in the United Kingdom. We had an exclusive distributorship with Seaworld for over 2 decades. And since then, Mogbonju has grown in reputation and also in scope. The company became incorporated on the 13th of November, 1984. That's about 36 years from now. We have our offices located in Lagos and Abuja. And also we have our warehouse located in Lagos. As a company, our vision is to be one of the best medical equipment distributors, and also a company that maintains high quality medical equipment and medical products of first choice. Our mission is to continuously improve on the supply of healthcare products that conforms with international standards, that is in terms of quality and technology. Our watchword is quality. Like we normally say that if we cannot guarantee it, then we cannot supply it. We place priority on quality more than cost, because we believe that an equipment that is gotten by our customers must be able to do much more than what the customer expects, and also must have high quality. Our core values are respect for human lives. We place high priority on human's life because we know for sure that what we sell and the job we do is to care and cater for the lives of human beings. So we don't just dump anything on our customers. We don't just sell anything to our customers. Knowing that they will be used to save lives, we do our best to make sure we give quality products. We are professionals in what we do. The owner, the directors, the managers of this company, they are medical practitioners. They have vast knowledge when it comes to equipment that are being used in the healthcare system. We are passionate about what we do. We have great passion for what we do. It's not a business that we're just doing because we need to make ends meet. No. We have passions for what we do because we understand the nitty-gritty that is in this business, and also the need for the kind of products and the quality of products that we supply. We are a very reliable company, and also our products are very reliable. We supply our products and we are very sure that we can go home and sleep with our two eyes closed. Because we supply quality products, we are very sure that it will always deliver at every given time. And of course, lastly, resilience. We have great resilience. Like we always say that if there's anything you're looking for when it comes to medical products, by the time you call Mogbonju Nigeria Limited, that will be the end of your search. Because we go all out across the globe to get equipment for our customers. So no matter what it is or how difficult it is to get that equipment, just call Mogbonju Nigeria Limited and you'll be sure you will get them. And of course, we have various partners that we distribute for. We have partners across the globe. We have partners, that we distribute for in every region of the world. First on the list is Seaward Medical. Like I mentioned earlier, we distributed solely for Seaward Medical. We distributed their products for over 2 decades. They're now trading as Seaward Tackle. Also, Cardiac Care Limited in the UK, United Kingdoms, we are a distributor for them. Scalar Surgical, makers of surgical instruments. We're also distributors for them. They have high quality medical instruments. Nidec USA, we are distributor that's maker of oxygen concentrator. We are a good distributor for Nidec in Nigeria. And we support all their spare parts. We also distribute for Seca. Seca is a company in Germany. We are their distributor in Nigeria, and we have partnership agreement with Seca. We support 100% spare part of all their products. And also we supply all the product. We distribute all the products from Seca. We also distribute for 3B Scientific in Germany. They're makers of training models, various types of training models that you need. You'll be sure that we can give you high quality. We also distribute for Mindray. Mindray is a company in China that supplies high quality products. Mindray's product cuts across the globe. We are one of their distributors in Nigeria. And of course, over the years, we've done a lot of projects. And we are very happy and glad to tell you that we have successfully completed various projects, ranging from supplies to federal hospitals, state hospitals, federal medical centers, teaching hospitals, National Hospital Abuja, and also to private hospitals. Amongst the hospitals that we have partnered with, we've done businesses with in the past, are the Lagos State Ministry of Health. We've done massive projects with them, and we still have projects that are ongoing with them. Also, we distribute and sell to OUTHC, Ile-Ife in Osun State, the National Hospital in Abuja. Also, we distribute and sell to Sickle Cell Foundation in Nigeria, and a couple of private hospitals, like Chevron Hospitals in Lekki, in Bagada, in Port Harcourt, in Warri, Shell Medical Services in Lagos, Port Harcourt, Warri, as well as NNPC Medical Centers. We also supply to Nestle Nigeria Limited. We have done projects successfully with Nestle Nigeria and also Nestle Angola, Cote d'Ivoire, Cameroon, and Nestle Burkina Faso. We are supplied also to Lagoon Hospital. We supply medical consumables and medical products to Lagoon Hospitals, St. Nicholas Hospitals, Association for Reproductive Family Health in Ibadan, amongst others. So if you need any of our products, or you are looking for a product and you have been finding it difficult to get, we want to tell you that if you call Mogbonju Nigeria Limited, you will surely get the product. Like we mentioned, we don't just sell products, we support our products, and all of our product comes with 1 year warranty. Some of them have 5 years warranty, like the surgical instruments that we can stand by and support for up to 5 years. Our manufacturer, they have this warranty agreement with us that we also apply for our customers, numerous customers. So these are our addresses and our contacts being displayed on the screen. You can call us or walk into any of our offices to get any of the products that we sell. Also, you can visit our website on www.mogbonjung.com to learn more about us and to see what product we have, various contracts we've done in the past. And also you can send in your inquiries through our email or our website, or you can call us through the telephone numbers that has been displayed on the screen. So if you have any question regarding or any inquiries relating to the products that we sell, you can contact us with the information on the screen. In the course of the program today, we'll be running promotional videos on some of our equipment or items. And like I mentioned, all our equipment between now and October, if you make any purchase, you will get a 10% discount. 10% discount on all our products. And also, if you look at the chat box, we have attached for you a PDF of some of the products we sell that we can give you great discount on. So you can download the catalog through the link that is being shared on the chat box and see some of the products we have that we can give you even further discount on. So if you have any question during the course of this presentation, you can drop in the chat box for us, or you have any inquiry, you can drop in the chat box and we'll be sure to answer you. Thank you. All right, so the program continues, and now we are moving to the discussion session. But before we get there, for the sake of those that are just joining us, we are taking a virtual attendance. So we ask that you please write your name in the chat box below, your contact details. That is your name, your email address, and your contact phone number. We would like to have your details and your records. And thank you for joining us this morning. So today, to discuss with us on the topic for discussion today. We are looking at surgical procedures as related to COVID-19. Surgical procedures as related to COVID-19. So what effects, what are the effects that COVID-19 had on surgical operations, surgical procedures? And to be discussing this with us, we have highly esteemed speakers, two of them. The first speaker is Professor Peter Olaitan, and the second speaker is Dr. Olashode Israel Akimokun. So I'll be going through their citations shortly, and thereafter we will have them come up for these discussions. So sit back and enjoy this interactive session. First on my list, Professor Peter Olaitan. Professor Peter Olaitan is a professor of bones and plastic surgery, consultant plastic surgeon, and currently the acting chief medical director of Ladoke Akintola University of Technology Teaching Hospital in Oshogbo, Osun State. Professor Olaitan is a surgeon and an administrator. He has been having a good relationship with Mogbonju Nigeria Limited since he was a chairman medical advisory committee between 2005 and 2009. Professor Olaitan, you're welcome to the program.
Thank you. Good morning.
Good morning, sir. Good to have you join us this morning.
Thanks.
Our next speaker, second speaker is Dr. Olashode Israel Akimokun. Dr. Olashode Israel Akimokun is a consultant orthopedic and trauma surgeon. He was born in Ibadan, Oyo State. He graduated from the prestigious College of Medicine of the University of Lagos in 2002. While he was an undergraduate, he had a couple of distinctions in various courses in the medical school. He had his postgraduate training in orthopedic and trauma surgery at the Lagos University Teaching Hospital, Idiaraba, where he bagged the fellowship of both the West African College of Surgeons in 2014 and the National Postgraduate Medical College in 2015. He is currently a lecturer at the College of Medicine, University of Lagos, and an honorary consultant orthopedic surgeon with the Lagos University Teaching Hospital, Idiaraba. Dr. Akimokun has attended various local and international conferences in Mumbai and Madurai in India, Singapore, Dubai, and the United States of America. He has published academic papers and he is involved in some ongoing clinical research projects. Dr. Akimokun's area of interest include general orthopedic, management of simple and complex fractures, both in adults and children, pediatric orthopedic, shoulder, hip, and nail joint point management, and joint replacement, arthroscopy, and sport medicine with complex reconstruction surgeries and management of back pains. Dr. Akimokun, you're welcome to the program.
Thank you for having me. Good morning.
Good morning, sir. Thank you for making our time to join us this morning. I will also mention again that if you're just joining us on this program, please, on the chat box, we would like to take your attendance. Kindly write down your name, your contact number, and as well as your email address so that we can have your records. All right, so going straight to the discussion this morning. If you have any question during this discussion session, you have any question for our esteemed speakers, you can as well write them in the chat box. We'll take your questions as they come. Welcome again, sir. So here today, we are looking at the topic, surgical operation as related to COVID-19. So the effect that COVID-19 had on surgical operations and is still having. So my first question goes to you, Professor Olaiton. COVID-19. A lot has been said about it. A lot has been, we've heard a lot about it, and it has affected the way we do things, even in the outside world. So I'd like us to tell us, what are the major lessons learned from COVID-19, putting surgical procedures in perspective?
Yeah, thank you very much. I appreciate you organizing this meeting this morning. I must say that, like we have all seen, COVID-19, which started sometimes in 2019 December in Wuhan, India, became pandemic and affecting every part of the world and everything that we do. And so a lot has been learned on this pandemic. And so if you look at surgery, for example, or healthcare generally, especially in Nigeria, a lot of people have said, look, COVID-19 has actually exposed us, has told us who we are. So, and that's a big lesson, how low our health facilities have been and the need to improve our health facility. A lot of training has gone into this COVID-19. A lot of people have learned a lot of new things, new ways to do things. A lot of facilities have been upgraded in the course of this infection prevention, which before now wasn't so much of a priority in most of our health system. I think that has also come in high on top. That a lot of people now think about how to protect themselves, how to prevent infection to themselves, infection to their patients, infection to even their families when they get back home. So a lot of upgrades in our theaters, in the way we operate patients, in the way we care for patients, a lot of improving our facilities, even inside the theater. So we've learned quite a lot of things from this infection, even though it's a negative thing that we have such an infection that took a lot of lives. But the positive part of it, lessons that we've learned, is also tremendous in the need to upgrade our system, in the need for training and having much more knowledge, and the way to improve the facilities within the theater, outside the theater, in the hospital setup. So I think we've learned a lot from this pandemic, as generally and especially as surgeons and people who are involved in surgical procedures in the theater.
Thank you so much, Professor Lighton, for that. Let me ask you, Dr. Akimokun. So what has changed? What has changed, putting surgical procedures in perspective in the surgical units of, hospitals? What has changed because of this COVID-19?
Thank you for your question. A lot has changed. And I will not only put the spotlight on the surgeries that we do alone, but I will start from when patients visit the hospital. Because surgery is just one of the ways, a minute part of treatment of patients. Patients coming to the hospital, maybe from emergency or patient that may want to have elective surgeries done. And so they have to come in through either the emergency room or the clinics before they can get to the theater. And so a lot has changed the way we do our things. Now we've created a lot of areas in which patients, because now you don't know those that are positive or those that are not positive, and sometimes you may have to do tests for them. And sometimes some of these patients are in between. So those that have symptoms, what I said, the lot has changed. Even in our emergency room, we have ways in which we try to triage those that may have the COVID and those that do not have COVID. Those that we suspect may have COVID, we have to put them in a particular place until the test is done on them. If it's an emergency, you be very careful the way you want to transport them. So a lot has changed really. So like I said, I will start from the emergency room in which you are trying to separate and be sure that okay, for those that may be suspected to have COVID or those that you're thinking may have COVID, you want to put them in the buffer zone so that at least they won't infect those that do not have COVID. And then even also when you want to transport them, those that have COVID, you need to make sure that people that are going to transport them are fully kitted so that they don't, infect the carer as they are being moved to the theater. Even in their clinic also, the way we arrange their clinic is totally different now. And even in the theater, the procedures we do, separate theater has been made for those that have COVID and then for those that don't have COVID. And so a lot has changed in our practice and in what we do. And it's interesting because what we are trying to do is to make sure that we be able to curtail the infection and then also prevent people from getting infected. We are not segregating people. We are not pointing fingers at them. We are not making them feel as if once you have COVID, it's a death sentence. No, it's not a death sentence. It's something that a lot of people have survived. But just because we want to be sure that we limit the rate at which infection spread, because that's the only way in which we can control things. And that's the reason why things are changing the way we do things in our hospitals. Thank you.
Thank you so much, Dr. Kimoko. Thank you for that. So I'm going to ask you this next question, based on what you just said. And also, Professor Olaitan, I would like you to react to it after Dr. Akimokun. So because of COVID-19, we discovered that a lot of elective surgeries are either delayed or postponed. So what are the criteria for determining whether or not surgery should be delayed or postponed?
Thank you. Well, at the point where the COVID infection rate was peaked, and then when the system was shut down, yes, a lot of elective procedures were postponed. Only patients that have an emergency or elective in which you know that if you do not operate them, they may die early. You want to do those such surgeries, and so, but now that the hospital is fully functional, there are no postponement for any surgeries anymore. But then, when the COVID-19 infection was picked, the decisions about who to operate or who not to operate was basically based on some certain scores, that were provided by by some group of people. I know about the American College of Surgeons that provided a scoring system that helped us to be able to say, okay, this is a patient we want to take in, or this is not a patient we want to take in. Just because we want to be sure that we do not deny patients that really, really, really require surgery. We don't want to deny them. The score that was propounded and that we used then was the elective surgery acuity scale, and it graded patients based on their acuity, based on how bad what we're thinking about. Graded the patient in different scoring system, tier 1A, tier 1B, tier 1, 2A, 2B, and then 3A, 3B, based on the acuity of the illness that they have and also how healthy the patient is. And based on that, we'll say, oh, this patient I may have to, postpone the surgery or may have to go ahead with the surgery. But now, all patients, once they come to the hospital with surgical needs, are planned and then also we go ahead. But one thing is that for those that have the COVID symptoms and are not those that have COVID symptoms and maybe they are symptomatic and they still need surgery, sometimes we may want to do tests for them. And if the surgery can still be postponed, you want to wait for that until you have a negative result. But like I said, we don't wait for any patients that require surgery, a surgery that may be an emergency. We don't want to wait for them because we know that we have ways in which we can add what we need to do. So make sure that you are fully kitted when you are going to operate them. And then there are some procedures in the theater you want to try and avoid. For us in orthopedics, yes, most of the things that people are worried about are the aerosolization of doing the intubation and then any procedure that may require, upper respiratory tract surgeries. But for us in orthopedics, the ones we are worried about is the use of diatomy, and then also when we are doing what we call irrigation, which you want to make sure that you clean the area where you're operating properly. And so those are the areas we are worried about. But like I said, once you are fully kitted, you have your N95 face mask, you have your face shield, you are fully kitted, you can go in an operating patient, especially for those that have emergency. For the elective ones, they can think about, okay, can we wait a little? Can we see if the result comes negative before we go in or not?
Thank you so much. So, Professor Lighton, sorry, I need your reaction. How is it like in Osun State?
Well, I mean, at the beginning, when at the peak of the infection, one of the things that I mean, like during the lockdown, globally, everybody agreed that cases should be elective cases precisely should be discontinued, while only emergencies were taken. That was at the peak of the infection. But over the time, people began to look at things a little more closely. Patients who have uh, cancer, that you think that if you delay their surgery, they could actually become, the prognosis can be worse for them. So you want to consider such patients. Of course, one of the things that was done was to actually screen such patients for COVID. If they are COVID negative, then you take them to theater and operate over that after some time. So, but for now, I think a lot of it has gone into the practice, and that most centers would screen the patient that want to have elective surgery. And once the patient is COVID negative, they go on and operate the patient. Of course, in Osun, what we did was to have incidentally, I am the incident manager of Osun COVID-19 and coordinating everything. And so what we did was to screen patient. If a suspected patient comes into emergency room and we feel they need surgery, what we do is to say, okay, let's screen the patient. If we screen the patient, even if it's an emergency case and we know that this patient is positive, we have a theater in the COVID isolation center where we operate such patients with full PPE, and of course, with full protection of the healthcare providers while operating the patient. But today, basically what we do, like we said, things have been eased off. And so except somebody is showing symptoms, some surgeons prefer to screen every patient that comes that they are going to operate on. And once the patient is positive, they do even elective cases. For emergency cases, of course, also they do some screening to make sure that the patient is COVID negative. And if the patient is COVID positive, they take them to that. Of course, there is a problem about the timing of between the time you do the test and when the result comes out. This result doesn't come out immediately, so it takes like 24, 48 hours sometimes. And so the rapid kit test is also something that we've been using. Of course, this is not 100% sensitive, but it has really been of help. So thank you.
Thank you so much, Professor Lighton. Thank you. I have a question for you, a follow-up question, and I also would like Dr. Akimokun to react to that. But before I ask you the question, let me just inform our audience once again. Thank you for joining us, Dr. Gabriel. And I guess this is Dr. Luka Akinlade, I guess. So please, like we mentioned earlier, we need to take a virtual attendance, or we are taking virtual attendance. Kindly write your name, your contact.
This is Akinlade.
Oh, okay. You're welcome. Good to have you on the show, sir. So please, on the chat box below, kindly write your name, your email, and your contact address. Your contact details, so that we can take your full details, for this program. Also, back to you, Professor Lighton. So you mentioned something about, testing patient before surgery. Kindly clarify. You mean you will test all patients, even the ones that didn't present any symptoms for COVID, before a procedure can be done? And if yes, in Nigeria, I know of someone that did the COVID test and it took about 2 weeks. So if the surgery needed to be done in less than a week, and then you are waiting for a COVID result to come in 2 weeks, maybe 3 weeks, you've not seen. So what were the other options that are available, and what will happen if the result is positive? So I have 3 questions in one. And I would also like Dr. Akimokun to react to it after you, sir.
Yeah, thank you very much. Well, it's not as bad as that in Osun. We get our result within 24 hours most of the time. Occasionally, when we had a lot of patients screened, we got it in 48 hours. But as it is today, we get our result in 24 hours. that does not mean that there are cases that we're not with. For example, we've had patients who are COVID positive on treatment for COVID who develop appendicitis and you have to operate. Or you have a patient who is pregnant. We've had pregnant women who was term, who was positive, and we had to operate because she went into labor and then she couldn't deliver by herself. Okay, so that's straightforward. Now, the other group of people are people that come in that have elective cases to do, and some surgeons, and not everybody, believe that, look, before we can operate you, in order to ensure that everybody is protected in the theater, then you go and do this, the screening. And usually within 48 hours, such patient, somebody has thyroid swelling, or somebody has a malunion of femur, and you want to do your surgery on it. So it's not a life-threatening thing. It's been carrying this for ages. So really, it's not something that if you delay for 24, 48 hours, the patient is going to come to harm. So a number of surgeons will say, look, I need to have this COVID test and be sure of your COVID status so that you don't put others in danger. And so that also helps to reduce the quantity of material that will be used in the theater. For example, every patient that has COVID and you are going to operate on them, everybody in the theater wears PPE, full PPE, and full PPE for 7-8 people in the theater. And the cost of PPE is about 22,000. They are about full PPE. So multiply that by 8 people, and then you now think about that. So you're going to be doing that for every patient. So it's good if you can screen elective patients, and that's what a number of people, a number of centers are doing around. Screen elective patients. Once they are negative, within 24, 48 hours of their result, you take them to theater and operate on them without necessarily putting all the full PPE. Of course, you still protect yourself. But there are still the other group that come and then they are emergency or semi-emergency, and you're not sure of what to do. If they are not COVID positive, you have not tested them. And so such patients, we do use rapid diagnostic tests. And like I said, that has helped us tremendously, but it is not without its flaws. It is not 100% sensitive. So you can have false positive, you can have false negative, and indeed we have had that. But most of the time, in most cases, if you get the result and then you know that this patient is positive, and then you can treat such a patient as a COVID patient in a COVID theater. Okay, so we separate the patient we treat in the normal routine theater are different from the patient we treat. So we don't treat the COVID patient in the normal routine theater. So we take such a patient, once it's positive, we take them to the isolation center and do the surgery for them. So we don't have, like I said, much challenge in terms of timing of the result. But the rapid kit test has also helped in a way, even though it is not 100% reliable.
Thank you so much, sir. Dr. Akimokun, before you react to that, I guess the situation in Nigeria, in Lagos State is different. Yes, because I know of people that, waited for about 3 weeks before they could get their, test result come back. I would like to mention again to our audience that if you have any question for our speakers, please write them in the chat box. Also, we'll be taking them, during the course of this, discussions. All right, so you have the floor, Dr. Akimokun.
Yeah, thank you very much. Well, I think the situation in web profits is a bit different from where we are here in Lagos. Because for most of our tests, we don't get results until 3 to 5 days. And so it's a bit difficult for us to wait for elective cases, yes. And we don't even test, like you said, we have a screening questions that we ask them. And once we ask for the screening questions and then the score is low, we assume that they may not likely have COVID. And so those ones we don't even have to screen. For those that are in between, yes, we may have to say, okay, go and do COVID test. And then for those in which the score is showing that they may have been in contact with someone that has had COVID, then we want to screen them. So those that are in between, those whose score shows that yes, they may have probably been in contact with someone that had COVID, then we want to screen them. That's for elective cases. So we don't screen all our elective cases. We still screen them based on the information given to us, and based on trust and information given to us, if they have been in contact. And there are some other things we also ask for in that screening questions. And so if we screen them and based on the screening, we realize that yes, they may not have COVID and they are elective cases, then we schedule them as appropriate. But for emergency cases, we don't have the rapid screening testing in Lagos. And so we assume that they may have COVID or they may not have COVID. And so we use the screening questions also for them. And based on that, we take in for surgery. But the thing is that for those that are symptomatic, we take them with we have the COVID COVID theater for them that where they will be the surgery will be performed on them. But for those that are not symptomatic, usually we still take all the necessary precautions, but we still have to take them to theater and you have to drop it on. Because it's I don't know, it's a bit peculiar really, because if we have the rapid screening test like Prof is talking about in Lagos, but maybe we also will use it. But presently now, I don't think we use that in my center. No, not at all. But it's okay. So far, so good. So far, so good. Let me just say that.
All right, thank you so much, Dr. Akimokun, for that. Please, if you have any question, write in the chat box below. Kayode Solomon, thank you for joining us. Like we mentioned also, we are taking a virtual attendance on this program. Please, in the chat box below, kindly write your name, your email address, and also your phone number, your contact number, so that we'll be able to contact you after now. Thank you for joining us. So moving on, I would like to take Dr. Akimokun to react to this first, and then Professor Light also, please, I will need your reaction on this. So we were aware of the quest for the use of ventilators for the management of severe cases of COVID-19. So what are the eligible criteria for placing patients on ventilators, and what is the success rate?
For the use of ventilators, really, I think that this question will be have been proper answered by um, the people in ICU. But I think one of the main reasons why the patients are put on ventilators are basically when there is hypoxia. Once you put on the pulse oximeter, then it's showing low oxygen saturation in the blood. Then such a patient may require help, and the only form of help now is to use the ventilator. Well, I think we have been very, very fortunate in Africa and in Nigeria per se, in such a way that most of the cases that we have had, the COVID cases, have been mild symptoms and they might moderate. So not so many of them have required the use of ventilators, I would say. And statistics, we have not seen yet in papers in Africa based on success rate of people that are ventilated, electively based on the COVID. And so I really can't say so much. But like I said, if it is an ICU doctor that is there, based on what he had seen around, around the patient that have been put on ventilators, be able to say, okay, I have this number of patients, this is their success rate. For me, I have not had any reason why I have to send the patient to go and use a ventilator ever since COVID started, really. Thank you.
Thank you for that. So, Professor Light, I know you you probably supervise an isolation center there in Osun State. So, what are your thoughts on this?
Well, I mean, at the beginning of this pandemic, a lot of noise was made about ventilator, the need to have ventilators. In fact, our state actually had to buy a number of ventilators. Our isolation center has an ICU that has eight ventilators. And of course, like he said, the people in ICU, what they look at is the oxygen saturation of the patient. Once the oxygen saturation of the patient started dropping, you expect an 100% oxygen saturation. Therefore, patients who have COVID, one of the target area for this virus is the respiratory system. And so many of them present with respiratory difficulty, acute respiratory distress symptoms like symptoms, breathless, oxygen saturation is low. And at the beginning, a lot of people were using ventilators, mechanical ventilator on this patient. Our experience in Osogbo and like in many other places actually is that after some time we realize that actually these ventilators may not be necessary, especially at the early phase. Somebody is, we've had to treat patients who have oxygen saturation of 86%, 80%, and we put them on CPAP, not on ventilator. Initially, we were putting such patients on ventilator, and we realized that they didn't do any better. And so we started putting them on CPAP, oxygen by face mask, intranasal oxygen catheter, and we realized that they tend to do better on such devices that are not invasive, like ventilator, because if you're going to put somebody on ventilator, you're going to intubate that patient and you're going to continue to ventilate mechanically and all that. So we realized that the patient we put on CPAP, the patient we put on intranasal catheter, the patient we put on face mask, oxygen by face mask, actually do better than those who were putting on ventilator. And so what the first thing we did was to say, okay, every patient that come down with oxygen saturation low, that is low 80, thereabout, we put them on oxygen therapy with CPAP, with nasal catheter, and they tend to improve. They tend to do very well on that. Of course, again, we have a few of them that are not, that won't do well no matter what you do, and you realize that you just didn't have any other thing to do than to think about what's next, ventilate. Sometimes they are on that oxygen by intranasal or CPAP, and their oxygen saturation still continue to drop, sometimes up down to 70, 60%. And at that time, you find out that there is really nothing to do for them except you intubate them. But I must confess to you that many of such patients don't end up well. So ventilator, yes, but it is not the primary thing that we use. And worldwide, people have realized that that is not going to help most of the patients, but a lot we do well just by giving them oxygen by other means, CPAP, intranasal catheter, and all that. Thank you.
Thank you so much, sir. Thank you. Thank you for joining us, Oluwakemi. Please, we need you to fill the attendance by writing your details on the contact box below. We need your name, your email address, and your contact number to enable us keep your record and also contact you after this program. So, Professor Lighter,
yes,
let's talk a little about the mode of transmission of COVID disease. While it is believed that it is spread by air droplets, another study have also confirmed that the droplet can be aerosolized, especially during the use of intubation equipment on the patient. So what are your views about the concern of mode of transmission of COVID-19 disease?
Yeah, thank you very much. I would say that, you see, this is a virus that is novel, that is new, that is evolving, and a lot of things, people have said a lot of things, and they say, look, it's this way today, it's that way tomorrow. People have talked, like you said, infection cannot only be gotten through droplets over time. It's okay, it can be aerosolized, like you said. And that's the basis for social distancing. Don't move close to somebody, especially somebody who has upper respiratory tract symptoms and all that. So I think for me, I agree that, of course, droplets, of course, again, aerosolized, because droplets can be aerosolized. Somebody is sneezing, it can go into the air and then gets to you. And so the use of face mask becomes handy and important. And of course, social distancing becomes important. So I believe those two ways are true, but how far in the air can this go is a question. A lot of experiments have also been done on this to show that the distance doesn't have to be so much. I mean, within 2 meters or thereabout, that even if that person sneezes, the virus may not be able to get to the next person and all that. So I think these are evolving. It is a virus that is evolving, that is novel and new, and a lot of new things will continue to be got. As of today, I believe it can be transmitted by droplets, like you said, and of course by aerosol, by air, if especially you are too close to somebody who has the virus.
Thank you so much, Professor Lighter. Dr. Akimokun, can you please share your thoughts on this?
Well, Prof has said a lot about mode of transmission. Yes, by droplets. And then also, I know that people also talk about the virus settling on surfaces, okay, and that form the need why they say people should wash their hands, before touching any part of the orifices in their face, either the mouth or the nose or even also the eyes, and that's the reason why we talk about the use of the face shield and then also the mask. And so basically, Prof said that it's basically by droplets. Droplets, the virus can drop on surfaces, and that's the reason why surfaces need to be cleaned as often as possible. And then also be careful what you touch, and even before you put your fingers into any part of the orifices in your face, make sure you do a proper hand wash under running water with soap with soap, and then make sure you wash your hand properly and use hand sanitizer as often as possible. Thank you.
Thank you so much indeed, Dr. Akimakun, for that. I would also like to mention that on the chat box, we have attached a link, to some of our products. We are offering special discount on those products, so you can click the link to download the catalog. And also, if you have any question for our speakers, you can drop them in the chat box. And if you have not filled the attendance, please do so on the chat box by giving us your name, your email address, as well as your contact phone number. Modupe Olaiya, thank you for joining us this morning. So moving on, this question is for you, Dr. Akimokun, and then we will get the thoughts of Professor Light on this one. So let's talk about protecting our surgeon. So as a surgeon, we know you have mentioned earlier that the use of PPE, yes. So what are the infection prevention precautions that was instituted by the theater or surgical unit during the COVID-19 pandemic?
Thank you for that question. Um, since we know the mode through which the virus can be transmitted, and then we have to be sure that the ways to prevent this virus, will be towards preventing the mode through which it can be transmitted to people. And so some of the things that were done to prevent theater staff from getting infected, like I said, the surgical procedure in itself is a minute part. The protection for the theater staff starts from outside, not from the inside. And that part of it is what we've talked about screening of patients. If patients is an elective surgery, make sure the patient is properly screened so that at least for those that are COVID positive, can give them time to recover before you say you want to take for surgery. And then for those that are not, then you can say, okay, let's schedule them. Then for emergency, you know that for emergency patients, you assume, because like I said, in Lagos, we don't have the rapid screening test. So you assume that this patient may be positive or negative. But if the patient is symptomatic, then you know that this patient possibly may have COVID, and then you want to treat it like that. And so that is where you start from, knowing the patients that you want to operate from, or you want to operate on. And then from there, when you get to the theater, for those that are COVID positive, there's a separate theater for them. For those that are not, there's a separate theater for them. But in all, you assume that every patient may have COVID. And so we treat every patient as see they have COVID. And part of what is done is from when patient is coming to the theater, patients still on mask. They use their mask from wherever they are coming from. They don't remove their mask. And then also they wear gloves, okay, so that they don't just touch anything. And so when they get to the theater, the person that's going to receive them into the theater also maintain the normal social distance, and also the person is fitted, and then also with face mask as required and face shield, so that at least when the person receives them into the theater, anyone that's going to move closer to the patient is not fully kitted. As in for those that are not COVID positive, it's not that you are fully kitted, but there is an overall that you wear. You wear your gloves, you wear an overall, and then also your face mask and your face shield. And you'll be sure that, and the patient also is also on the face mask. These are part of things that you do to prevent whoever is coming in contact with the patient, not to get infected. And so when you receive the patient don't have to stay waiting for surgery. The idea of bringing patient staying for surgery we try to limit that, because initially what we used to do is that when you want to operate patient, you bring patient will be waiting, and then before you take it to theater. No, the waiting time has drastically reduced. If you're not ready for your surgery, they don't bring the patient, because nobody wants to bring the patient around the waiting room, and then the patient, like you said, you've not screened this patient, you don't know who is who, you don't know what is what. And then one patient moving to the theater, before now in our theater we have the anesthetic room, and then we have the theater sessions, and so that anesthetic room has been left redundant, and patient goes straight into the suite, and only the people that are going, if the patient, depending on the type of anesthesia you want to give the patient, usually we know that the procedure that produce a lot of aerosol are those that have to in which you have to do procedures in the upper respiratory tract, upper respiratory tract. And so if patients can, if you can do another form of anesthesia, for us, we use mostly now our spinal anesthesia or a combined spinal and epidural, for most patients that have lower limb. And then for upper limb, we even trying to look for ways in which if you can use other form of regional anesthesia that can help, instead of having to intubate patients for all form of surgery. Because like we said, and we know, that is when you intubate this patient that you put a lot of aerosol in the air, and then more and more people can get, infected. And so we try to prevent that. So in form of anesthesia, also we're looking for ways in which we can limit procedures in which you have to intubate patients, and then when patient, and then when they're going to do that, make sure that the number of people, like I said, we just make sure that we do things basically as if the patient is positive. So the number of people that will be present when they are putting in their tube, the anesthesia is trying to put in the tube, is reduced, so that at least, and then you wait for about 15-20 minutes before every other person comes in. And then once you come in, until the procedure is ended, you are not supposed to leave. And if you're going to leave, you're not coming back to the theater. All what we're trying to make sure we do is to make sure that at least people, the rate of infection is limited. And then also, like I said, some procedures are known to also aerosolize. For ours, as I said initially, the use of diatemy, and then also when we are irrigating the patient, and then the use of power instruments. So we try to limit all this so that at least we don't push a lot of aerosol in the air and then cause infections to spread around. And then for patients, for doctors themselves, everyone that's going to operate or they're going to be inside the suit must wear their face shield and their N95 face mask. In fact, N95 face mask and the normal mask, the normal surgical mask on it, so that at least we'll be sure that yes, because some of the N95 face masks, some people actually get this N95 face mask with a valve, and it's not protective at all, because you don't even know if the person you're working with may even have had contact or because sometimes you may not know, because a lot of people are actually asymptomatic in Nigeria. So you don't want to use people, we don't advise people to use N95 face mask with a valve. And so we also put a normal surgical mask on it, and you must be heated before you move close to the patient. That means you must wear your overall, and then you must be gloved. You don't just touch anything in the theater. And immediately after the session, the theater is decontaminated. All the surfaces are cleaned. All of them are cleaned. So that at least if you're going to do another surgery in that particular suit, you don't expose whoever is coming in also into COVID. And these are things that we try to do for patients. For those that are COVID positive, like we do the same thing, but you move them to the theater, to make sure that you observe the same procedure for them. And then instead of them stay, they don't stay in the recovery room after surgery. They move straight back into the ward, the COVID ward. But for those that like we said, we're not sure if we have not screened, but they're not symptomatic yet. They can still stay in the recovery room where they recover, and then they can then move to the ward thereafter. But all in all, like I said, all in all, we just like when HIV/AIDS came into being, and the use of universal precautions became this anthem for all surgeons. Also for this particular period, we assume all patients may be COVID positive, though they may not be symptomatic, but we assume they have, and then you want to be sure that before you move close to them, you are fully kitted. That's the only thing. You don't just do anything after that, and then you try to limit procedures in which aerosol can be produced to the hair, and then people can pick it up from there. You don't want to do that, and so I think that's just what we have done for now. I don't know if Prof will have more things to say about it.
Thank you so much, Dr. Akimokun, for that. Very insightful. I know, yeah, Lagos being the epicenter, then I know the situation will be different in Osun State. So, Prof, let's have your thoughts on this, please.
Yeah, I think Dr. Akimokun has actually said most of the things that we also do, and any theater for that matter would do during this pandemic, and it's a standard practice. And he has said most of the things. So, but I just want to add also that usually the anesthesia, the kind of anesthesia is also very important, because as much as possible, we tend to use regional anesthesia rather than the general anesthesia, because the general anesthesia will involve you, the anesthetist, having to intubate and all that. And so the contact with the airway at such a time is increases the risk. Of course, for the anesthetists, you want them to all be on N95 face mask. You want them to be on face shield. You want the patient also to be on N95 face mask, so that if in case you have to intubate, you intubate. Immediately you finish your intubation, you put the patient back on the face mask. Of course, the anesthetist is more protected. And the other thing is that usually we give like 1 hour thereabout in between surgery when you are operating patients who are COVID positive. But for non-COVID positive, of course, like he said, there has been an increased awareness, an increased need to protect to protect ourselves as surgeons, as workers in the operating suite, and assuming that like universal precaution that every patient that you are coming in contact with, not just even the patient, but everybody that is around you that is not a member of your family, you assume is positive, working together, you assume that person is positive, and you protect yourself from such people, wearing of gloves, hand sanitizer, hand washing, and all that frequently, and as soon as you finish each of the procedures. So I think basically I said most of the things. Those are the few things that I would like to have.
Thank you so much, Professor Lighter. So we have a question. Before I ask you the next question, let's take this question. It says, how true is the information that after recovery, most COVID-19 patients have serious side effects? How true is the information that after recovery, most COVID-19 patients have serious side effects? Prof, you want to share your thoughts on this?
Yeah, thank you very much. In fact, we've had cases of patients who have been discharged from COVID-19 camp, isolation center. They've done well, and then they are turned negative. They've gone home, and then they get home and they just collapse and die. There's an entity which some people have called post-COVID-19 lung syndrome. And a lot of damage is done, especially in the respiratory system for patients who have COVID-19. And so some of them still have this residual impact of this damage that has been done on their lung. And so it may be important. We may be treating a number of sequelae of COVID-19, especially in the respiratory system in the next couple of months. So it is true that most of the cases that we have seen have been on the respiratory system. Patients who have gone home and then they come back with problem with difficulty in breathing and all that. So that's the only one that I am aware of. I don't know whether there are other things that are, of course, a lot of underlying problems come up. We've seen patients who are never diabetic, and then they have COVID-19, and then their sugar just went up, and they become they become uncontrollable. The sugar becomes uncontrollable, and you have to do a lot of work. And for such patients, of course, we've seen somebody who did a sugar last week or thereabout, and then this week has COVID-19, and by the time we are doing the sugar, it's over 300. And so we also think that COVID-19 has some problem, especially in terms of patients with diabetic patients, and also can't, we don't know, I won't say this loud, that can also initiate, for those who are susceptible to developing diabetes, can precipitate diabetes mellitus in them. And after the COVID treatment, of course, you still have to continue to manage this diabetic problem in such patients. So diabetes mellitus, lung issues, post-injury lung problem are things that we have seen in our patients who have COVID.
Thank you so much for that contribution, Professor Lighter. So we share your thoughts, Dr. Akimokun, but before you do that, please, our audience, we would like to, okay, you're welcome, Dr. Omolayo. Thank you for joining us. Please, on the chat box, we are taking a virtual attendance. Kindly drop your name, your email address, your contact phone number, so that we can, keep your record. And like we mentioned, that there will be special discount on all of our products. We'll also be able to use this information to match, against your name when you come to claim the discount. And also, there is a link that has been shared for some of our products that we are giving a special, a further discount on all of our products. So if you click on that link, you can view some of the products that we have special pricing on also. But don't forget, on all of our products, we have 10% discount that lasts between now and end of October 2020. So, Dr. Akimokun, back to you. Can you share your thoughts on the question, please?
Thank you very much for the question. Like we all know, the coronavirus, this particular strain, it's a new one. To say this is the full, complication that could arise following infection of this particular virus. And so, as time goes by, more and more research will reveal more and more about this virus, and then we'll be able to say this is exactly how this virus behaves. This is exactly the complication that can arise following, infection with this virus. Because I know, yeah, a lot of things have been associated with COVID. Even in orthopedic, there's something called COVID two, and so it's evolving. It's evolving, and so it's difficult for us to be able to say this is exactly how the virus will behave or is behaving. But I'm quite sure more and more as time goes by, we will get more understanding about the sequelae and the complications that could arise, following the infection of this virus. Thank you.
Thank you so much, Dr. Akimokun, for that. We are gradually coming to the end of the discussion session. Our audience, please remember that this is not the end of the program yet. We also have some special exhibitions, product exhibition segments, messages from our manufacturer, an announcement of and promotional videos on some of the products we will be giving some discount on. Please ensure we create your indulgence to stay by till the end of this program so that you will be able to see what we have for you today. So moving on, Professor Olalaito, I want you to take this, please, and then we share your thought also, Dr. Akimokun. So how long are patients being kept after surgery? So do you feel, because of COVID-19, do you feel the urge to, discharge them early enough, earlier than expected? What do you think, Prof?
Yeah, we don't. Like I said, COVID-19 patient who test positive for COVID-19 disease are managed at our isolation centers. And so after surgery, usually they move back to the isolation centers and we continue to watch. Initially, we were doing COVID tests after like 2 weeks or thereabout. We do a repeat test. If they are negative, we do another one after 48 hours. If they remain negative, we then discharge. But after some time, the WHO came up with something and said, look, anybody who has been who has had COVID-19 disease and is on for 2 weeks, you can actually discharge that person without necessarily doing a follow-up test on them. So today, if any of them, in fact, there are 2 of our patients who just got discharged last week, and one of them had appendectomy, and we kept him there. Appendix wound. Usually, if you do appendectomy for somebody within 40 72 hours, you can say the person should go home. But we didn't. We had to keep him in the isolation ward until the period we feel the period between the diagnosis and is going home was about 2 weeks. So we now say, okay, we know by now it should be free according to WHO standard, and then you can go home and get discharged. So we don't send them home immediately. We make sure that we still watch and be sure that they are safe to go back to the society without infecting the community.
So thank you so much. Dr. Akimoku, what is the situation like in Lagos State?
Exactly what Prof has said. For me, patients that have that are COVID positive, I mean, you can't say after surgery you want them to go. No, it's not possible. You have to be sure, like you said, WHO says after 2 weeks, then you can let them go, then they go. But for those that are not COVID positive, of course, the normal routine ways in which we be treating patients, what we still ensure them after 3 to 5 days, we just, I mean, depending on the type of surgery they have anyway, you know, I mean, we discharge them based on the normal protocols that have been used, for every patient that is in. Thank you.
Okay, thank you so much. This question I would like to ask again for patients that have postponed surgery. During the COVID-19 pandemic, when, the peak was high here in Nigeria, especially in Lagos State, the hospitals are very clean. In fact, they almost will want to attend to you outside the gate. They don't want you to come in at all, So I want to find out, so if a patient have a postponed surgery, what do you expect the patient should do while he's waiting? Dr. Akimoku, let's share your thoughts before Prof.
Thank you. Well, like we said, it depends on what we are thinking. Take for instance, I am an orthopedic surgeon. If patients that has maybe a non-union, a mild union of the bone comes to me and then the surgery is postponed, I'm not expecting the patient to do anything extra other than what the patient has always been doing. Because um, I mean, he's been living with it. It's not that it wasn't an emergency anymore. And so the normal lifestyle that the patient has been living should live, except that the patient also should protect himself or herself from getting COVID by the use of mask, washing the hand frequently, using hand sanitizer, and then social distancing. That's the only thing I expect such a patient, to do. But for those in which maybe they may need maybe a kind of surgery in which they have some other medications that they are taking, to relieve the symptoms of those things that of symptoms of the disease in which they want to do surgery for. They continue taking their medications. I mean, these are just like I said, for patients that whose surgery was postponed, there must have been a reason why such surgery was postponed. If it's an emergency, like I said, we use a certain scoring system to decide which patient goes and which patient you have to do the surgery on as soon as possible. So, based on that, I think we weren't expecting the patient to do anything extra than protect themselves from COVID, having COVID. Because if you now say, okay, now you want to do your surgery, and then the patient is now COVID positive, you have to postpone it again. So just for them to make sure that they protect themselves, don't I mean and then make sure that they don't get infected with COVID while they are still waiting for the surgery. Thank you.
Thank you so much. So Prof, how is it like in Osun State?
Yeah, I mean, I think basically it's the same thing. If your surgery is postponed, well, let me say also that a number of people think that it's not an emergency, it's not an emergency, it's not an urgent thing. Actually, a lot of them were scared coming into the hospital for surgery at such a time, especially when we are at the peak of the problem. So they don't even want to come. And of course, when you educate them well, they know that the dangers and the risk, and of course, they understand. But like Dr. Kimoku said, there are patients who are maybe cancer patients who you want to postpone for a few months, and you think that they may benefit from chemotherapy. So you can actually commence adjuvant chemotherapy on such patients before you say, okay, we can then do the surgery later and all that. So essentially, I think they should just continue protecting themselves. Of course, again, we are hoping that this pandemic is coming to an end. We are praying and hoping, and it looks like the trend in Nigeria is actually getting lower, and we just hope that we are seeing the end of it, and so life can go back to what it used to be, and people can have their surgery, people can have their life back, and we move forward. Thank you so much.
Thank you, Professor Lighton, for that. We are gradually getting to the end of the session. Please remember that this is not the end of the program. We still have more in store for you. We have, special products presentations coming on. We also, like we advised, that we're going to be offering some special discount on our products. Please, if you're just joining us, remember to write your name in the chat box below, your name, your email address, your phone number. We would love to keep your record and also to contact you after this event. So, Prof, for disinfecting the hospital environment, so what are the preferred disinfectants? You know, some use infrared lights in the theater, chemical mist, air conditioner. So what is your preferred disinfectant, putting COVID-19 in perspective?
Yeah, what we've been using in our state has been chemical decontamination. We use hypochlorite, we use hydrogen peroxide, and infrared is not readily available to all, and so it's not used by all. But if you have that, good. But of course, for decontamination, not just in the theater, even in our wards, sometimes you have a patient who unknowingly admitted to the hospital, admitted to the ward, and then whilst the patient is on the ward, you just find that the patient is COVID positive, and so you shut down the ward, decontaminate the ward with chemicals and disinfectants, and I said, hypochlorite and all that. So essentially, that's what we've been using, and then even in the theater, that's what we also have been using rather than the infrared.
Thank you for that. How is it like with you, Dr. Akimoku?
Basically the same like what Prof has said. I mean, that is the practice isn't different from what we do here in Lagos. I mean, that's what we use. Same thing like he has said.
Okay, so before the closing words, I would like to ask, up till today, some people in Nigeria don't believe that COVID-19 exists, even in Lagos State, where we have high cases, number of cases. So what are your advice for such people, Dr. Akimoku?
Well, it's unfortunate that some people still don't believe that COVID-19 exists. It's unfortunate, but I would say COVID-19 infection is real, and please, we have to protect ourselves from getting infected. It's like I said, it's a new disease. We don't even know the sequelae or the complication that would arise after getting infected. And so it's better you protect yourself from getting infected than assuming that it doesn't exist and then get infected and then having to battle a lot of things that may come up thereafter. I beg the people of Lagos, people of Nigeria, please protect yourself. COVID-19 is real. Thank you.
Thank you so much. Professor Lighton, can we have your thoughts with your closing words, please? Hello, Prof, are you there?
Hello, sorry, I didn't hear you well.
Okay, so I don't know, did you get the question? Hello, Prof, can you hear me? Oh, I guess you're having some technical issues with Professor Lighton there. Okay, so while we wait for Professor Lighton to come on, Dr. Akimokun, thank you so much for joining. Any last words, closing words for our audience?
Thank you very much. I may just say that with this COVID-19 infection, and then I think we may have a new normal. What I mean, new normal, meaning that we may have to continue to wear this mask. We don't know until when, but until when scientists are able to say, hey, the infection is very low, or we have not found a way in which we can prevent people from getting the virus, either through vaccine or through a particular medication that people can use as prophylaxis. Until then, we may have to use our mask till then. And also for us health workers working in the hospitals, we may continue to have that new normal also, in which we may have to wear our mask and our face shield And then also assume that every patient that comes to our hospital, and even people that are working around us, may be asymptomatic carrier of this COVID virus. And we have to continue to protect ourselves until the period when we're able to say, yes, these are ways in which we can be prophylactically protected from this particular virus. Um, I think that's just what we need to just accept for now. It's a difficult thing to continue to wear masks for as long as when you don't know, but it's something that we need to accept for now. And until then, when we are sure that we can be protected without the use of mask. Thank you very much for listening. Thank you.
Thank you so much indeed, Dr. Kimokun, for that contribution. Prof, are you there? Okay, I guess it's not. Thank you, Dr. Kiboku, for coming. It has indeed been a great, interactive section with you. We've learned a lot from you today, having to share from your wealth of experience. Thank you for all the many contributions, and we hope that this COVID-19 thing the effect will be suppressed, and we pray that God will help us and will continue to help us. We pray for you and your team as well. God will continue to grant you the grace and give you divine protection while you seek to care for others. You will not be infected, and you won't lose your life as a result of this. Prof, good to have you back, sir. Can you hear me, Prof?
Thank you.
Good to have you back. Sorry, we have some.
Yeah, I can hear you. The network just got a little messed up.
Okay, so we are about taking the closing words from you, but we also ask that, some people don't believe that COVID-19 exists, even up till now, despite, all that has been said. And as a man that has seen a lot of COVID-19 patients, what are your advice to them? And also, give your closing remarks.
Yeah, thank you very much. It's unfortunate that some people don't believe. Somebody actually told me that he has never seen a COVID-19 patient, and so he doesn't believe it exists. And I said, before you can see a COVID-19 patient, you get to the isolation ward. By that time, you are already COVID. I just want to tell people that COVID-19 is real, and even though, thank God, it looks like it's going down in our country, but it doesn't mean that we should let down the guard. We should be obedient to the rules. Wear your face mask, put on use your sanitizer, the hand washing, the social distancing, and the parties. We need to be careful with all those parties, attending parties. Even when we go to our religious houses, we need to be really careful. Social distancing is still very important. So I think we cannot say it has ended. We cannot say it is over, and it is our responsibility.
Wow, I guess we lost the signal from Professor Lighton there. Thank you once again. Thank you for joining us. We are moving straight to the next segment of the show. We hope that you will stand by, throughout this program so that we can have, okay, I think Prof is back. He's actually still speaking. Prof, your mic is on mute. Can you unmute? Oh. Hello, Prof, can you hear me?
Hello?
Oh, okay, we couldn't hear you. The
Hello?
signal, we lost the signal and then.
Yeah.
Okay, go on, please.
Yeah, apologies for that. So I was just saying that.
Go on, sir.
Yes, I was just saying that COVID-19 is real. We need to continue to protect ourselves. In our different gatherings, we need to ensure social gathering and protect ourselves with face masks, hand washing regularly, and sanitizer and sanitizing regularly. And while we believe God and pray that God will help us and remove the pandemic from us, the service of the health, while it lasts, let us protect ourselves. Thank you.
Thank you so much indeed, Professor Lighton. God bless you. Thank you. Thank you, Dr. Akimokun. Thank you for sharing your thoughts. The program still continues. We really want to appreciate you for your time. Despite your very busy schedule, you still made out time to be with us on the program today. Thank you so much indeed. And we pray that the Almighty God will continue to protect you and your team in this your great battle, great fight, against COVID-19 to ensure that its effect is eradicated. We pray that God will give you victory and will also protect you and your family from contracting this virus. We also ask that all your efforts, you will see results. We'll get results for all your many, many efforts. Thank you so much indeed. Thank you. God bless you. So we'll move straight to the next segment. We want you to please stand by. We have a product presentation now from some of our product coming up. Like we mentioned, Mogbonju Nigeria Limited, we distribute and supply high quality medical equipment. We are also going to be taking some messages from our manufacturers. The manufacturers we distribute for in Nigeria, some of them. Also some goodwill message from some of our customers. We hope that you sit back and enjoy the presentations we have for you. Don't forget, if you're just joining us, remember to write your name in the chat box below. We'd like to take your contact, your name, your email, your phone number. We'd like to take that so that we can contact you after this event. Also, there is a special discount, 10% discount on all of our products that you will buy between now and end of October 2020. Also, we support 100% spare part for all of our products. I will see you shortly. I want you to take a look at this video for the presentations we have for you today. And then I have more information for you when I come back. Hello everyone. Thank you for joining us. This is Mogbonju Nigeria Limited Virtual Exhibition 2020, a medical exhibition where we showcase some medical products. We're so glad that you could join us online. My name is Stephen Kende, one of the managers at Mogbonju Nigeria Limited. Today is the theater equipment introduction, and I'll be taking you through the equipment one after the other. So we'll be walking through the theater equipment introduction. And the first item on my far right here on the log is the Seca 213 stadiometer, which is used for height measurement. And also we have the Seca 769 adult digital weighing scale with height measure and also with BMI function. The platform is very comfortable and with high sensitivity. It also has anti-slide platform in order to prevent the patient from sliding off. So if you care for precision for health, then you think Seca. We are distributor for Seca products in Nigeria. So we have a lot on the log, more than what we have displayed here. So if you need any of Seca products, just contact us. And also here, we have the anesthetist chair with a wide range of sitting space and also backrest for comfortability. And also it has the foot ring where the anesthetists can easily put their feet to relax. And of course, it's a swivel chair, can go up and down and also can rotate. So when an anesthetist is attending to the machine and also to the patient, can easily switch between the two. And again, here we have the patient monitor. This is the touchscreen patient monitor. That's the touchscreen function. And also supports 5 parameters. We support up to 6 or 8 parameters depending on the customer's requirement. All you need to do is just to touch the screen and put in your desired measurement. And this function just normally. So we have the anesthetic machine. This is Elmed 7200 anesthetic machine. We support this product as well as Mindray. We are a distributor for Mindray products in Nigeria. We support all the anesthetic machine from Mindray range, talking about the A7, the EX65 anesthetic machine. So for this one, we have the flow meter for oxygen and also N2O, nitrous oxide. Of course, this machine has the function of delivering guaranteed oxygen when you try to give the patient, administer nitrous oxide to the patient. It also has a very wide working surface where the anesthetist can easily walk. There's a walk area. And also, it has the ACGO function, that's auxiliary common gas outlet function. And here is the outlet when you turn on the switch here. It also have the capacity to support pipeline oxygen from the wall as well as cylinder. So this is the gauge measurement where you get to see the level of the oxygen remaining if it's connected to the wall and then if it's from a cylinder. So the cylinder can be hung behind the machine. And this machine comes with 2 vaporizers, allothane and isoflurane. It also have the capacity to support enflurane and sevoflurane vaporizers, so depending on the customer's choice. We have 2 cabinets with this, 2 drawers cabinet, where the anesthetists can keep their products or accessories. Next to that is the portable anesthetic machine. This is a mobile type of anesthetic machine. It has the oxygen flow meter and 1 vaporizer. So your APA valve has color codes for you to see the safe zone from going to yellow to red on the APA valve. And this can be moved around by anesthetist in order to be used, anywhere on the field, in a remote area, and what have you. Just here I have the suction machine. Suction machine, this is a UK brand of suction machine made by MG Electric. We are a distributor for MG Electric in Nigeria. This is a high vacuum, high flow theater suction machine. It comes with 2 autoclavable suction bottles. This is just one we're displaying here. It also have a mobile type or a static type. This is the static version. The mobile types come with a tire and also an handle for ease of movement in the theater. This is very good, very durable. We support all the parts 100%, and we guarantee this also as well. Next to that is the diathermy machine. This diathermy machine has the function of monopolar and bipolar cut and coagulation function. It's a 300-watt diathermy machine. It's an electrosurgical unit that can be used in the theater. So it can be used for minor or even major operations. So we have them. And then we have this brand. This is Promise brand. We also support Sotron brand and the likes. So next to that is the surgical instrument. The surgical instruments, our surgical instruments have 5 years warranty. Yes, you heard me right, 5 years. We support them, and that's because they are made from the purest stainless steel materials. We have our manufacturers in the US and in UK. They support us with 5 years warranty for this product. So we can guarantee that if you buy one, it will not have any defect if you handle it properly. Defect that is not caused by handling or damages. It won't have any defect for the next 5 years, and even afterwards. but we give guarantee for at least 5 years on these products. Okay, right here we have the operating table. This is the MedWise operating table. We support different brands of operating table. We support the Upmaster operating table from the UK. We also support the DRE Avent Healthcare operating table from the United States of America. So this one here is MedWise from India. It comes with complete accessories. This right here is can be used for gynecological purposes, can be used for surgical purposes, and also for orthopedic purposes. Here it has a kidney elevation of up to 25%. It has the armrest, the shoulder rest, the anesthetic screen, and also the lithotomy pose. This right here is made with high-grade stainless steel material, and that means we can guarantee it for anti-rust for a period of 5 years. Yes, because the practices around the theater, when it's being disinfected, the waters that they use on the floor, we can guarantee that these will not get rust because the best grade of stainless steel material has been used to produce this. Okay, so this right here, this cover is waterproof, prevent the foam during the process of disinfection when you clean or wipe off with liquids. This is waterproof, prevent the foam from getting soaked with water. So behind this we have the theater screen, which covers a wide range of area. This comes with a washable clothing material. We also have another type that comes with a plastic material that can be easily wiped off or disinfect with disinfection solution. This has a very sturdy base. The legs are very strong. There is guarantee on this. We have 1 year guarantee on it, and also the leg. Unlike other screens that after some time they get broken or goes apart, this one, a lot has been done on the leg and it's very strong, can be dragged from one point of the theater to the other. So here we have the surgeon stool, very comfortable. It has a wide sitting range area with protective cover that can be disinfected easily. Is impermissible to water. Water cannot penetrate this, and also the base, the plastic base, is very, very strong, and this can be wheeled around. The height can be adjusted up and down. We have the PPE coverall. This is protective coverall that prevents against COVID-19 and other infectious diseases of virus. This here is from UK, it's CE marked. This protects the user 100%. Water cannot penetrate through this or any virus or any infection. And also she have on the face goggle, the goggle for protection, and also the face mask. We also support the shoe cover for prevention from any form of infection. And also we have the powder-free gloves. She's putting that on. So with this appearance in the theater, you can be sure of full protection against any form of virus. And also next to that, we have the thumb loop apron. Thumb loop protective apron. It's also impermissible to water. Fluid cannot penetrate and also prevent from viruses. This can be used in the theater as well. We have the hairnet, we have the face shield, and also, like I said, the coverall. The shoe cover. Okay, so we also have reusable theater wears and also disposable. I've mentioned we have the theater gown, the doctor's gown, the patient gown, and the lots. So like I mentioned earlier, we don't dump our products. That's part of our best practices. We don't dump our product even after the warranty period elapses. So because of that, we have biomedical engineers. On my right here, I have Engineer Awa, and on the left, Engineer Tam. So we have biomedical engineers that goes around to not only install, train the end user on proper usage of the machine, and also service the machine and do a follow-up checkup on the machine from time to time. So if you have any issues with any of your medical equipment you get through us, you can call us and you can be rest assured that we attend to them. Thank you. You have seen it, like we mentioned in the video, these are some of the products that are being used in the theater. We have much more than what we have displayed. We have a lot more than what we can display. So all you need to do if you're interested in any of our products or any medical equipment, please contact Mogbonju Nigeria Limited. Our addresses will be displayed on the screen again, as well as our contact information. So because we believe in quality, we also believe in giving our customers good warranty period. If we cannot guarantee a product, then we cannot supply that product. So we have warranty policies of minimum of 1 year and a maximum of 5 years on all of our products. So depending on what type of product you've gotten, you'll be sure that you get a warranty of at least 1 year on them. And this warranty is not just on paper or by mouth or by message. It's something that we also apply from our manufacturers. So our manufacturer extend this to us, and also we extend to our customers. We also support our products, 100% spare parts of our products. So that means whatever we supply, we are sure that we can supply you spare parts for every of our products. We have 100% support for spare parts from our manufacturers as well. So very shortly, we'll be looking at some previous exhibitions that we have had. We normally have this year in, year out physically, but due to COVID-19, we have, adjusted to the trend, and then we've come online. We've done a virtual. We've come to do a virtual medical exhibition. However, I would like you to take a look at these videos. These are the sights and sounds from our previous exhibition. Just maybe you can find a product that will interest you. I'll see you shortly. welcome back. Shortly, we are going to be looking at a scenario where you have a very busy emergency room. We're introducing a product, the Mindray Passport Patient Monitor. This is a new product. It is very useful in emergency room, in theaters, can be disinfected easily. You can easily move it around on the wheel. And of course, when it drops, you'll be sure that all you need to do is to pick it up. Before we do that, I would also like to explain that we partner with hospitals, partner with various hospitals, partner with healthcare centers in ensuring that we fill the gap of the medical equipment needs. Of course, we have a very flexible payment plans. We can supply you medical products and then give you a payment plan that can allow you to pay instrumentally. You can pay instrumentally, in accordance to the agreement that we have. We want to make sure that we stand by you all the time. There are cases that people need to equip their hospitals, but they don't have enough, resources to do that. What we do as a company, Mogbonju Nigeria Limited, is we give you the opportunity to be able to take some of our products and then pay instrumentally. We also provide support for you during this period and even after the period. We have warranty on all of our products, and so the warranty, whenever it elapses, some have up to a year, some have up to 5 years. We also give a new service plan to our customers so that we can continue to monitor or manage that product for them. This is just to make sure that they enjoy the product as much as we want them to. So the next video now is introducing a product, Mindray Passport Patient Monitor. I'll see you shortly. Welcome back. So we support this product as well as other products from Mindray. Mindray is a company in China, and we at Mogbonju Nigeria Limited, because they manufacture high quality products ranging from patient monitors to defibrillators to also ventilators, anesthetic machine, and wide range of products. And they have high quality for all their products. That's why we are partners with Mindray in Nigeria. We supply and support all their products 100%. It's time for us to take some testimonial videos from our customers as well as our manufacturer. Because we have so much importance, we place so much importance on quality, I want you to listen to some of our manufacturers and what they have to say concerning Mogbonju Nigeria Limited. And then I will see you shortly.
Hello everyone and greetings to Nigeria. I hope you, your colleagues, and your families, you're all doing well. My name is Ioannis. I'm the area manager at Sika, and I'm responsible for the African region. Sika, a German-based company based in the northern part of Germany, in Hamburg. We're doing medical skills and measuring solutions, means from the baby scale up to adult skills for a special kind of patient, like obese patient or patients who are lying in bed, nutrition, for nutrition departments, ICU, so all the different kind of skills, we provide the right solution. We're doing this since 180 years, so a long history for this company. We are operating in more than 110 countries worldwide. And of course, we're doing this in some countries directly, but in the majority of the countries we do with our local partners. In that case, I'm really happy that for Nigeria we are working with Mogbonju, and we are happy to have such a reliable partner. But what means partner for us, for Sika? A partner is someone who shares the same values and strategy like Sika. So it means we believe in high quality products. We believe in to provide the right product to the right client and to fulfill the customer needs. A partner means also that has a good product knowledge and is always capable to provide the right solution to the customers. Furthermore, just to sell the product is not enough for Sika, so we also believe in a very strong after-sales support and in general maintenance and service for our products, so that we ensure that the customer's investment will be long-lasting over the years. A very important part also for Sika, and once again we are really happy. I'm really happy to work together with Mogbonju. Best greetings, Madame Ayo, Stephen, and the entire team of Mogbonju. I wish you all the best. Hope you're all doing well, and a lot of success with this virtual exhibition. I think this is a very difficult year, and of course we have to adjust the way we do business. And I'm really happy that you're trying to do this virtual exhibition. And once again, thank you very much for all your effort, for all your support over the years. And I wish you all the best. Take care and a lot of success. Greetings from Germany.
Hello everyone, my name is Purvesh Shah from VS International. I'm the director of the company, and we are partnered with Mogbonju for our range of healthcare products which are branded Medivise. And I would like to say a few things about the erstwhile founders, owners, and very stalwart ladies, they would be called, Chief Mrs. Betty Ojo and Chief Mrs. Ayo, who are both closely associated with us in working and in promoting and in harboring relationship between the two companies. And I would like to say a few things for this conference that we are having virtually this time because of COVID. First of all, the two companies are well aligned, and our thought process is the same because Mogbonju and VS International both believe in quality, which is the paramount thing in all our products. Whatever we do, we don't compromise on the most important fundamental, which is quality. Secondly, we also believe in deliverables as promised. When we tell a customer that our quality and our deliverables are so and so, we stand by it. We believe in it, and we know that it is very important for us to deliver on those commitments. And also, we both the companies also believe in no compromise on after sales or on the service aspect of the products that we deal in. We know for a fact that these are healthcare products. These are products which are for life saving and for hospital use, and so it is paramount for us that customer focus and customer centric is what our companies are. We believe, and we all know, and we also proclaim that for us, customer first. That is our most important criteria. Also the fact that, you know, everything that we make and everything that we achieve is because of our partners, and we find that in Mogbonju. They are our preferred partners. They are someone who we know for sure will deliver on the promises, will promote our products the way we would promote them, and we have a, you know, relationship which is kind of aligned in all aspects. So, you know, once again, I wish them all the best for this virtual exhibition, and we always come, we always participate. Unfortunately, we won't be there this year, but our you know, our support, our feeling, and, you know, everything is with them. All the best, Team Mogbonju.
Good afternoon. My name is Miss Odubela from Surgical Emergency. This exhibition has been an eye-opener to the various kind of equipment that are available and the ones we are lacking. And we are grateful that they've given us a discounted price so that we'll be able to purchase some of them. We are very, very interested in most of the equipment here, and we hope to get them very soon.
My name is Mrs. Priska Kekwe from Surgical Emergency Last. I'm so pleased and so happy coming to this seminar. Some of the equipment presented, I've not seen some before, but at least it's an eye-opener, and I believe our CMD will be able to provide some of them, we'll start using them, like the fission pump, to help us a lot. So the equipment, they are wonderful. Thank you, and thank you so much.
Mrs. Dorothy Young, Director of Nursing Services, Federal Medical Center, Butemeta, Lagos. What I see and feel about this exhibition by Mogbonju Nigerian Limited is a very good one. And I'm impressed because a lot of instruments and equipment are so good. Like I saw the ECRA sphygmomanometer, and I told them I want the Acoson of it. I've seen a lot of beds, the 3-crown beds, the 5-crown beds, which in my hospital we may need them. So I want to go and discuss with my medical director, the Dr. A.A. Dada, about it. I've written and gotten some lists that I'll go and discuss with him. And I saw the uniforms here. In our hospital we have a lot of uniforms. The accident and emergency is wine, and then the pediatric is flower. They said they can produce if I need. So I'm so much impressed. I know all the things that we need are here, and I've taken the exhibition office in Ogudu, which I will make a visit there. So I'm so impressed, and I want to thank the managing director, Mrs. Ojo, for what she has done, doing service to humanity.
Welcome back. There you have it. You've heard it all. Quality, goodwill testimonies from our numerous customers. If you have any questions or any inquiries on our promotional videos or products, as well as any product at all, kindly contact us. Our details will be displayed right now on the screen. Contact us via our addresses, our email, our phone numbers. You can also visit our website to learn about us. This is Mogbonju Nigeria Limited Virtual Medical Exhibition and Speaker Series 2020, Day 2. Tomorrow promises to be very exciting. On the chat box, we've put a link for promotional videos, some of the products rather, that you can download. You can contact us if you need any of them. We have mentioned that we are applying up to 10% discount on all of our products if purchases are made between now and end of October 2020. We have also said that if you have any information or queries or inquiries, you can contact us through our email that are being displayed on the screen right now. Our email is mogbonjung mogbonjung@gmail.com. That's mogbonjung@gmail.com. And also, you can write us or call us via our phone numbers or visit our website to learn more about us. Today's program is coming to an end, and I would like to quickly remind you that tomorrow is day 3 and the last day. We have highly esteemed speakers coming up tomorrow. We have Professor Bosede Afolabi that will be speaking to us tomorrow. Also, Dr. Atinuke Oluwakemi Olaleye, they'll be speaking to us tomorrow. Our program for you tomorrow promises to be very, very exciting. You can contact us now or after this program or thereafter with our information that will be displayed on the screen right now. So if you have any question, any inquiries whatsoever, be sure that Mogbonju Nigeria Limited will be waiting to receive them and to also apply a 10% discount for you on all of our products. Remember also to download the PDF link that has been shared with you. We have a promotional products that has also been highlighted for us to give you special discounts on. And also on all of our numerous products, we have up to 10% discounts on each one of them. So today's program, there you have it. Thank you for joining us. And we look forward to having you again tomorrow, which is the final program for this exhibition 2020. So the program starts by 9:30 a.m. tomorrow. And then we hope that you could join us early enough. If you have any questions or any inquiries, please feel free to contact Mogbonju Nigeria Limited. I will be more than glad to attend to your needs. Thank you once again for coming on the show today. We are so glad that you could make it and stay with us even till this time. See you again tomorrow. Thank you and enjoy the rest of the day. Bye-bye.